Practical explanation about how vaccinations work, why they're part of routine care, and what parents should know as they make decisions for their families. So let's explore this together. My name is Dr. Nicole Campbell, and I'm the Chief Impact Officer here at Smart Start of Mecklenburg County. And let's take a moment to introduce our experts. Would you like to begin, Adam?
Thank you all for being here. My name is Dr. Adam Blatt. I am an assistant professor within the Division of Pediatric Infectious Diseases at Atrium Health, Living and Children's, and the Wake Forest University School of Medicine. And I also serve as the medical director for our pediatric vaccine trials.
Thank you for being here, Adam. And Jennifer?
Hi, good afternoon. My name is Jennifer Heath. I am the immunization manager for Mecklenburg County Health Departments. I am a nurse by training, so happy to be here.
Thank you. Emily?
Good afternoon, everyone. Thank you for inviting me to this panel. My name is Dr. Emily Cooper. I am a family medicine physician. I own a practice in Charlotte, Dominion Health Family Wellness Center.
Okay. And Joy?
Good afternoon, everybody. Excited to be with you this afternoon. My name is Joy Smith. I'm also a nurse, and I have the pleasure of serving Mecklenburg County as the Communicable Disease Director.
Bonnie?
Good afternoon, everyone. I'm Dr. Bonnie Coyle. I am the medical director at the Mecklenburg County Public Health and also very glad to join everyone today.
Okay. I get everybody. Because everybody started popping in. I was losing my people. Okay, I got my people. Okay, so let's go ahead and get started. The first question is, what are the most important vaccines a child receives in their first year, 5 years of life, and why? Um, Adam, you want to give us some background on childhood vaccines?
Yeah, uh, thanks for that question. When I think about that, what's the most important vaccine? The simple answer is all of them. The longer answer is it's really hard for me to pick what's most important. And if I put that into context, I think a lot of families have heard about measles across the state line in South Carolina. And if I said measles vaccines are the most important right now, that kind of defeats the purpose. That means that we have already fallen behind. The whole point of vaccines is try to prevent disease. And we have a bunch of vaccines that we give to children today against diseases that used to wreak havoc. And we've been routinely vaccinating children for over 80 years. And that's the reason that we don't hear about some of these diseases anymore. And the only way we keep not hearing about them is if we prioritize all vaccines, even if we're not hearing about them in the news.
Emily, you want to add on some more about the most important vaccines and why they're given?
Sure. When I think about vaccines, especially in those first 5 years of life, I think about protecting children, as Adam said, during their most medically vulnerable stage. Babies and toddlers have very immature immune systems. They have smaller airways. They have less physiologic reserve, meaning, circulating in their bodies. So infections will hit them harder. Just in case people kind of don't know the vaccines that we give, I almost hesitate to give this list because it's really long, but it's important because the early childhood schedule protects against diseases that, as Adam said, historically cause things like meningitis, brain injury, pneumonia, severe dehydration. So you're really protecting your child. Some of those vaccines include the whooping cough, or it's called pertussis, measles, as Adam mentioned, polio. There's one that protects against pneumonia. Rotavirus is a major cause of infant hospitalization for dehydration. You have hepatitis B. You also have varicella. What I tell parents is this. These vaccines protect against diseases that we don't see anymore because we vaccinate. And I always welcome questions because the goal is to prevent hospitalization of your children, long-term complications, and any rare but devastating outcomes.
So, are there any differences in school vaccine requirements, like from when a child is born till they're 5? Like, what are the differences in the vaccines that children need to start school? Jennifer and Bonnie, you, either one or both of you want to talk about that?
Sure, I can start. So the vaccines that are required for school are pretty much the same. So the vaccines that are required for childcare centers will be age appropriate, and then there are vaccines that are required for children to start school, usually between 4 to 6 years old when they're starting pre-K, kindergarten, and then other required vaccines you'll see in seventh grade and 12th grade. So our vaccines come in a series. So usually there are, for example, hepatitis B is a series of three. So the first time the child will receive it is at birth. It's the only vaccine that we give at birth. And then the second one is at 2 months, and then the third is after 6 months of age. So we give a series of vaccines, usually to build up the immune system. So usually the requirements are the same. I will say there are some vaccines that are not required for school, like flu, but it's still highly recommended because it will prevent serious illness and even death. So even if it's not required for school, we still encourage their parents to vaccinate their children.
Bonnie?
That was a very comprehensive answer that Jennifer gave, so I don't really have anything more to add there.
Okay. Can you explain how vaccines work in a child's body in the simplest terms possible, Adam?
Of course. So vaccine's going to contain either one of three things. So it's going to have the germ that causes disease in a really weakened form. It might have the whole germ, but it's killed, or what we call inactivated, or it might just have parts of it. And so when the vaccine is introduced into your body, your immune system responds and thinks it's the real thing. And it's really giving the immune system practice or training it to respond to those same things in the future. And because the vaccine it's just weakened or dead or just parts of these germs, training goes really well. So well that the body forms a memory of how it did it. So the next time that it sees that germ, it already knows what to do and it can respond quicker and more efficiently. So that's going to decrease the chance of getting infected or getting sick. I think that's the important concept too. I think some people think that vaccines are equivalent to a medication that's kind of circulating your bloodstream and it's going to prevent everything. No vaccine's 100% effective. You still have to rely on your immune system to respond. But we know after, again, 80 years of vaccinating routinely, the training goes really, really well. And the majority of children are not going to get sick and not going to get serious disease if they're vaccinated.
Any of our other panelists want to contribute to that answer? Thank you for that comprehensive answer, Adam.
Of course.
And that was the simplest term. I appreciate that because I understood that.
I'm good. Thank you.
So right now we're hearing a lot about, in terms of vaccinations, we're hearing a lot about some myths that people have about vaccinations. But can we talk about some of the myths that you guys have actually heard and what does science actually say? Bonnie, you want to speak to that?
Sure, I can touch on a couple of things. One of the myths that's out there frequently is, well, I don't want the vaccine, or I don't want my child to get the vaccine because the vaccine will make them sick. And in fact, as Dr. Blatt just said, that the vaccines generally cannot make you sick, but might cause some side effects that might make you feel a little uncomfortable. And then people mistake that for that they actually caught the disease from the vaccine. Another common misconception that has been debunked is that vaccines will cause autism. And it takes many, many years to bring a vaccine to being used in the general community. It goes through many, many years of testing. And there has been lots of research studies done that have demonstrated that there is no increased risk of autism in children when they are vaccinated.
Any other myths that the professionals on our panel want to address that you all have heard and had to debunk?
Yeah, my favorite is one that, we chuckled about when we, met before this. I've had several parents ask about elderberry, which is a supplement, and they feel that giving their child elderberry is better than vaccines. And while, there is some assistance in elderberry with more symptoms of various things, it's definitely not a substitute for vaccines. In fact, it doesn't cause the immune system to do anything as far as the actual illness. So, elderberry is gaining a lot of traction. So that's a conversation that I have a lot. Another myth that I wrote down is one that children receive too many vaccines, and that this will overwhelm their immune system. And we know that that's actually not true either, because we know that children's immune system is exposed to thousands of antigens daily. You cringe when the baby's crawling on the floor, or, they pick up their school-age siblings or cousins' cup and put their mouth on it. So having these vaccines and getting the training that Dr. Black mentioned for their immune system is good. And it's not going to overwhelm their system again, as Dr. Coyle mentioned, that these vaccines are tested and shown that they are overwhelmingly safe. So there was just a couple I wanted to add.
Oh, for sure. Thank you. Those are actually really great real world examples. Anybody else on the panel want to address any myths and what the science says? Adam?
Yeah, I say I have a long list, but I'll
Of
limit
course
it
you do.
to. I think two of the things that I hear more, natural immunity is better. There's
Hmm.
no data to say that it's better. Yes, if you get infected, sure, your immune system can make a memory and respond similar to if you got a vaccine. The whole concept of natural immunity is that you have to get sick in the first place, and there's no guarantee that you're just going to have a mild illness and shake it off. You can get really sick, and to be honest, if you get really sick, you generally don't make any immune response after all of that. So vaccines are the way to prepare your immune system ahead of time and decrease the chance you get sick without actually having to get the illness. The other one that's becoming more common, there are toxins in vaccines, especially aluminum has gotten a lot of headlines. Aluminum has been in vaccines basically since we've had vaccines in the 40s. It's there because it helps make the immune system respond better to lower amounts of the germ. So it actually can help make vaccines safer because you have to put less in. And then, as I believe Bonnie said, we study vaccines. The bar to get a vaccine approved through all the clinical trials is really high. And then we still keep an eye out for side effects after they're approved. And we know this from the trials and from all the surveillance and from even other studies that adding aluminum to vaccines has not been linked to any chronic illness or any ill effects to the body.
I think
I could jump in with one last thing that I've heard too, that some people will say, well, the vaccines don't work because I got a flu vaccine or I got a COVID vaccine and I still got
Hmm.
disease. Some of the vaccines that we give are extremely effective at actually preventing the disease. Some of the vaccines, you may not completely avoid getting the disease. You may still get infected if exposed to the disease. However, you have a much, much milder form of the disease. That we see with flu and COVID, where someone who's been vaccinated may still get a mild case of the disease. But that's the point. The vaccine is preventing you from getting very seriously ill or perhaps even dying.
I think that all of these are great points. And I think that I was sharing with the group and Adam really addressed it. But when I was telling them when I was in college in the 90s, I'm dating myself, in the 90s, that's when the chickenpox vaccine came out. And I was student teaching and I went to get tested before I got the vaccine to see if I should get it. And they were like, oh, no, you have natural immunity. You don't need it. I said, well, can I get it anyway? Can I get the shot anyway? And they were like, no, it'll ruin your natural immunity. You don't need it. And all the doctors on this panel chuckled. And they were like, we've come a long way since then. Hopefully, this
Mhm.
is not the situation for you anymore. I was like, so you mean I've been out here winging it with no chickenpox vaccine? I might get, I denied the shingles vaccine. I need to get, I got to tighten up now. So this has been helpful for me as well. So the next question is, how do you build trust with families who are hesitant about vaccinating their children? Joy, you want to speak to that?
Yes, so I think, when we were talking, and one of the things that we've learned with our measles cases, that my nurses have learned when they work with people around perinatal hepatitis B events, is that it's important to build relationships and have conversations. And it was so interesting before we signed on, I was looking at LinkedIn and the announcement for the webinar, and somebody talked about motivational interviewing. And we are making a conscious effort to not just say, here, get this vaccine, but to hear from people. What have been your experience? Where does your hesitancy stem from? I can remember having a conversation with a father. We were going back and forth about hepatitis B vaccine for his child. And eventually the conversation led to, in my country, this was used, I was punished if I did not, if I wasn't vaccinated. And so it's important. And that's what we've been trying to do is have conversations, see where people's experiences have been, what it's been like, and then share the science that our doctors have shared about how vaccines save lives, and the evidence that we have, and work together towards a solution that's best for their children and their families.
And Bonnie, do you want to weigh in on that as well?
Yeah, I think as Joyce said, it's so important to meet people where they're at, to hear what their concerns are, to provide the education that they need, and not to judge or in any way sound like you're going to be punitive toward them, like refusing to see them or that sort of thing. So there's so much misinformation and just volumes and volumes of information out there that people can have access to, and it can get confusing.
Mhm.
And so it's important for providers to have the conversations that Joy has already alluded to and just understand what the concerns are that parents have and help to provide the information and the education so that they can make a more informed choice.
So I know back in 2020, when I was in New York, they had eradicated the option for exemption for children when they were in school. They said that there would be no more medical or no more exemptions for vaccinations. Everyone was mandated to be vaccinated if they were in a public school. Are there any exemptions here in North Carolina? And if so, how do they impact public health? Jennifer, you want to speak to that?
Sure. So, by law in North Carolina, each state, the laws can vary in each state. But in North Carolina, we accept two types of exemptions, medical exemptions and religious exemptions. So our medical exemptions, they're about maybe a 30% level or less. But there are children who may be going through treatments, may have compromised immune systems, and it's not safe for them to be vaccinated at that time. And that's usually signed by a doctor or a provider. And then the religious exemptions are written by a parent. We don't have to know their religion. They don't even have to give specifics, but parents are allowed to write a letter stating, I have a religious exemption for either all vaccines or some vaccines, and then they submit it to their school. And so those are accepted in North Carolina. Where we get into trouble is when we have an increase in religious exemptions, and then those correlate with an increase in disease in our communities. So we really want to find out the reason for religious exemptions. Is it because, parents didn't have access? Do they need more education? Or is there another reason? Because we as public health professionals really want to attack that and say, okay, like what are the needs so that we can address the concerns so that we have as many people vaccinated as possible to reduce the incidence of disease in our communities.
And can you talk a little bit about herd immunity and why does it matter for schools and communities?
Sure. So I'll start. Dr. Cole, did you want to start? I'm going to take it.
Uh, Yes, herd immunity is a really important concept in public health. It essentially is describing when you have enough people who are immune to a specific disease. And the way we become immune to a disease is that we either become infected with it and develop antibodies, or we're vaccinated and develop antibodies. And then when you're immune, that means even if exposed to the germ that causes the disease, you won't become infected. And so when enough people are immune, that germ can't spread anymore. And so that's how you start to stop some of these diseases from being so common. The importance of it is that there are always going to be some people who cannot be vaccinated. And so when you have herd immunity and most of the people around that person are protected and immune, then they can't become infected and potentially give it to the individual who maybe couldn't have been vaccinated. Herd immunity, you can see how well herd immunity works when you look at uh, how common infectious diseases have been over the past 100 years. Back in the early 1900s,
Oh,
we had
yeah. Hi.
hundreds
Thank you,
of
Anna, for giving me a call
thousands
back. Yeah, I just
of
wanted to
children
say
being
real
infected
quick.
uh,
So
by some of these common diseases, and thousands of them would die. Now we, in some cases, don't see any of these diseases anymore. Or see very, very infrequent cases. And that's because we have enough people vaccinated or have natural immunity that the germ just can't take root, so to speak, and grow in people and then spread from them to other people. And that it is one of the greatest successes of the past 100 years that we have eliminated some diseases and nearly eliminated others through building this herd immunity concept.
So I heard a lot about herd immunity during the COVID epidemic, but in terms or the pandemic, in terms of herd immunity though, so you said within the last 100 years, so herd immunity has existed and it's been known, but we just, the common person really hasn't heard about it, and no pun intended, hasn't heard about it until recently. Is, is that the case?
Yes, herd immunity is a concept that we have used to think about vaccinations. You need everybody to be protected at once. So if before you had vaccines, there was always people who were still at risk of the disease because they didn't get infected yet. Herd immunity, by providing vaccines and getting everyone vaccinated, or nearly everyone, now that germ doesn't live as often. So your question being, yeah, this has been a concept in public health and the medical field we've known about for quite a while. It may be less common for the general public. COVID and flu are interesting in that, because if you think about people, even though people are getting vaccinated every year, we have not been able to achieve herd immunity. It's because those are two viruses that are very good at changing themselves. So that's why we need to get vaccines more commonly. They make these shifts, they change their structure so that you now need a new vaccine the next year to try to protect against them. So a lot harder to achieve herd immunity when you have a germ that can keep mutating and changing itself to evade the immune response.
Oh, that's a really good point. I never really thought about that. But yeah, you do wonder why you have to get a flu shot every year, but it's because it's able to morph itself. It's
Yes, exactly.
tricky. It's a tricky
Yeah,
virus.
it's
Okay,
tricky.
got it. Anybody else want to weigh in on the herd immunity piece or anything we just talked about on the panel? Okay.
I will
As
start.
we're
Oh, I'm sorry,
going
Dr.
to
Campbell.
answer questions, I'm sorry, one second, Joy. We're gonna you can put questions in the chat as we're talking because we will address your questions at the end. Go ahead, Joy. I'm sorry. I mean
Oh,
Jennifer. I'm
That was
sorry.
Jennifer.
no
It was
problem.
Jennifer.
Sorry,
I'll
Jen.
just say, just recently they introduced the phrase community immunity, just so that the general public can think of it in a communal sense. Increasing others to be vaccinated creates immunity in our community. So that way, when those rates go down, you have disease that spreads quicker. So that may be a term that people start to hear more. In addition to herd immunity, is community immunity. In certain diseases, we need higher levels or percentages of vaccination, kind of like measles. So if we're not at 95% vaccinated and we start dropping, again, that's when you start seeing those disease numbers go up. So I think it's important for the public to realize, like, we need 95% of people to be vaccinated. Even if everybody's not vaccinated, we still need enough people to prevent disease in the community.
And so when we talk about that, can we also talk about between you or Bonnie about the immunocompromised populations or other vulnerable populations such as infants? How are they impacted by the vaccination rates?
Well, that's so important for why we want as many people to be vaccinated as possible, as Jennifer just said. There are some individuals who will either not be able to be vaccinated because they're immunocompromised or have some contraindication, or that are too young. Some vaccines aren't given until a child's a little older and can mount an immune response. Those individuals are very vulnerable, and we have to protect them. And so that's why we need everybody else to be vaccinated, so that they don't become infected and then potentially spread it to someone who is not able to be vaccinated. As Jennifer said, you need about 95% of the community to be vaccinated to prevent the spread of measles, because measles is so infectious, so easily spread. And so we want to protect pregnant women, infants who can't get the vaccine yet, by making sure everyone around them is vaccinated, and that germ can't get into that community and then spread to the person who is vulnerable.
I remember my mom had leukemia and she had to get a bone marrow transplant. And so she had to wear a mask everywhere. People were like, oh my gosh, why does she have a mask on? It's really to protect her from all of us. She didn't have anything to give to them, but when she got the bone marrow transplant, it totally obliterated her system, and she had to restart all her vaccinations all over again like a baby. So people have to also realize that, those vulnerable populations, that they really are, some of them are vulnerable to just the slightest germ from any of us. So it's really important to remember. Um, so Joy, can you talk to us about how does the health department respond to outbreaks such as whooping cough or measles, things like that, what we've been talking about?
Yes, sure. So, our public health communicable disease team receives reports about people who test positive for these diseases or who are suspected of having them. And they go right to work. Conducting investigations, calling, reaching out to the people to ask them about their symptoms, where they've been, who they might have been around. We want to, at all chances possible, prevent the spread of those diseases. And we're looking for those vulnerable populations so that we can determine whether or not they're vaccinated or they need to be vaccinated. We're checking to see if these individuals are connected to what we call congregate settings. So are they in school? Are they in childcare? Do they work in the healthcare setting? Because we want to make sure that the cases and their contacts get the education that they need, that they get prophylaxis if they need it, so that we can stop the spread of those diseases. And then we also do what's called surveillance. So we look to see where we're seeing cases. We look at our immunization data to see where our vulnerable locations are. And so we don't only respond when we get reports of positive individuals who are positive. We also, in our downtime, work to connect with the community to share this education and this information proactively, relationships, just like I talked about when we're talking about trying to get people vaccinated, relationships with our community partners are important during outbreak investigation. And outside of that, it's easier to work with somebody alongside of them if you've developed those relationships before the actual go time. I call it, comes. So we work with our hospital systems to make sure that we have communication systems in place because there might come a chance where one of the cases is connected to them, and we need to be able to determine who would have been exposed in that setting, who needs prophylaxis, who needs education. We could be working with the jail systems on cases. The school system, we're very fortunate in Mecklenburg County to have school health as part of public health, and that makes it easy when there are cases of whooping cough in school to get information about who's in the classroom, if they're not vaccinated, do they need to be sent home? And so that's what the nurses in this team, but not only this team, I was sharing with public health, we are to be commended that in North Carolina, we have only had, knock on wood, 24 cases of measles, where our neighbors to the south had 997. And I think that that speaks to the work that we do as public health and as a community to make sure to get kids in communities vaccinated, to share the importance of vaccine. And so I just want to take that time out to congratulate and applaud all of us for our efforts, private and public.
Awesome. Thank you for that. Um, so did anybody else want to weigh in on any of that on the topic of whooping cough, measles, things like that? Because our next question I'm going to take for each of you is what does the future of vaccination look like? Let's start with Adam. What does the future of vaccination look like in your mind?
Um, Couple things. So I think from a research standpoint, um, we're gonna find other ways to get vaccines into people other than just needles. I mean, we see that already we have some oral vaccines, we have some vaccines can be sprayed up your nose, and all of this research is designed to one, make vaccines more comfortable to give people, and also to really enhance the immune response where you need it the most. They've talked a lot about like flu vaccines are really good at preventing serious disease and hospitalizations, death. They're not as great about preventing the actual infections or upper respiratory tract infections, but part of that is because you can't get as much immunity right there in your nasal passages. So getting more research that are going to design better vaccines is one. And we're going to see still a reshuffling of what is in the vaccine schedule. So, yeah, every decade, look at this in decades. Researchers are going to look at what's affecting children, and we know vaccines are such a great tool to prevent infections and disease. More are going to come out. They're going to see what's affecting children currently. Those vaccines are going to come in. And then the other thing to consider is that some may leave the schedule because a lot of these things are specific to humans. And if you can get a concerted effort across the globe, you can get rid of some of these diseases. We saw it with smallpox. We came really close to doing it with polio. We're still close. But if these diseases don't circulate anymore, we don't have to vaccinate against them. So, but that takes a lot of coordination, not just in the United States, but certainly across the globe.
That's a really great point. Emily, what is the future of vaccination in your mind?
Yeah, when thinking about the future, to me, I kind of look at three major components, and Dr. Blatt already touched on the technology one, but then there's access and trust. The only other thing I would add on the technology side is that I think, along with improvements in how vaccines are delivered, that there's going to be better surveillance systems that are going to be able to monitor that safety in real time. On the access side, we already see that there's growing effort to make vaccines easier to receive. It's not just going to the doctor's office, but your families are able to get vaccines through their pharmacies. You see a lot more community clinics where vaccines are offered, and then school-based programs. I really think that convenience matters and is important for families. Finally, the biggest, area where we could improve is in trust. We live in a time where there's a lot of information out there, and a lot of it might be misinformation, but it spreads really rapidly, right, across social media platforms. So, rebuilding that trust means that we have to be transparent in our communication. We have to acknowledge uncertainty when it exists, and then continue to meet families where they are, as we talked about earlier. While the future is not just about developing new vaccines and shifting the schedule, like Adam talked about, I think the biggest place, especially for physicians, is about strengthening those relationships between healthcare and the communities. And just to plug family medicine, that's what I love about it because, not only do I take care of kids, but I can take care of them as adults. And then there's that built-in, relationship and trust that we're able to foster. So.
Jennifer, you want to say something about the future of vaccination?
Sure. So, vaccination rates have been steady in North Carolina, even during COVID-19. And I just expect for us to continue or even get even better. I will say that vaccines are one of the top 5 public health initiatives. So some other public health initiatives that people may not think about is like fluoride in the water, hand washing, motor vehicle safety, sanitation. So vaccines are one of them. And I will say right now, the pivot that we have seen is that we have become more mobile. We have a lot of mobile clinics. We go out to schools. Maybe even in the future, school nurses may be able to give them at school, or like Dr. Blatt was saying, is like it may be in our food and the kids just eat it. Like take your Flintstone vitamin like I used to growing up. So I just expect the rates to increase and get even better and better. North Carolina has done really well. And I will use this opportunity to put a plug in for Smart Start, planning a clinic in June, a teddy bear clinic. So being out in the community, at a community event where we're offering vaccines. So we are really trying to address any barriers to access, barriers to transportation for families. So if there's an event, you may just see us show up to offer those vaccines to make sure everybody is protected.
Awesome. Joy, you want to say something about the future of vaccination?
Yeah, I think everybody has made excellent points. I guess I'll go back to and share. I'm excited for the opportunity to have conversations. There's a lot of information out there. We talked about some of the myths, with the recent change in the federal judge blocking the changes to ASAP. People want to know what's going on. It all can get a little confusing. And so I appreciate the opportunity to have a team who's been trained and available and ready to share with people why vaccines help us, help our communities, and just to engage in that conversation.
And Bonnie, you want to say something about the future of vaccination?
Yeah, I think my vision for the future has already been touched on. I'll just briefly say that technological advancements are just exploding. Dr. Blatt talked about some of this. I think that the exciting idea of being able to find ways other than needles to get the vaccines into people is really going to be helpful, since so many people do sort of have a fear of needles and that. So it's exciting to see that. And also the development of like messenger RNA vaccines like COVID, or even DNA for some of the vaccines to make them even more effective and safer, although they are already safe and effective, are pretty exciting. And then from a public health perspective, again, as some of the folks have already said, vaccines are one of the absolute greatest accomplishments of public health. We have saved thousands and thousands and thousands of lives because we have vaccines available now. Infectious diseases were the number one cause of death in this country in the early 1900s. And we have been able to eliminate many of those deaths as a result of vaccines. So, from a public health standpoint, I see the future as one where we can educate more and engage with people more and help them understand how vaccines work and how safe they are. And people do become vaccinated so that we can, as Dr. Blatt alluded to before, eliminate some of these diseases like we had with smallpox and get to a point where we have complete eradication of these diseases and they aren't harming anyone.
Awesome. We're going to go to the chat. There's a question in there already, and I'll ask it. And if you have any questions, please feel free to pop them in the chat as we get toward the end of our conversation. We'll go ahead and address the questions you have, and then we'll have one more large question for the panel. But this question is, I'd like to go back to the exemption issue. We have seen a fairly large increase in the last couple of years in families coming into MEC pre-K and using the religious exemption. Are these families and children posing any risk to other children besides others that have also chosen exemption? Or is that risk only to those not choosing vaccination? Anybody want to answer that?
I'll start, and I don't want to kind of hone in on exemption, but to share kind of more broadly, when we talk about communicable disease and these diseases don't have passports. They don't knock on your door when they come in, and so they can affect more than the people who are choosing exemption. We talked about your mother. That was a perfect example. I appreciate you for sharing. And so that's kind of why we have these conversations to protect ourselves, but also to protect others. I mentioned that one of the reasons we didn't see as many cases as other states, were because of our vaccination rates, but we were not, as Jennifer mentioned, at the 95% that we needed to be. And so I would encourage everyone to make sure you have your measles, mumps, and rubella vaccine or a record of it and get vaccinated because these diseases, as we've talked about during the conversation, can have some pretty serious side effects up to death. So that's what I'll share.
Anybody else want to touch on that?
I'll say that it would be a risk for everybody, other students, the teachers, the administrative staff, anybody in the building. So similarly, like you never know what somebody may have an immunocompromising condition. So we want to keep everybody safe. So I would just say safety is the goal. We want to protect our teachers who may be pregnant. We want to protect our family members who may have somebody at home who's immunocompromised, and we don't want to take germs back to them. So it's the same reason why we ask children not to come to school when they're sick. Same type of thing. Germs travel. So we just want to make sure that nobody's family member or even ourselves is impacted negatively.
Um, I have another question. What are the common side effects of childhood vaccines? What is considered normal? And when should a parent be concerned and contact the doctor after vaccinations? Anybody want to?
Yeah, touch on that. If you think about, needle or like if you get a splinter, the next day tends to be red, swollen, a little tender still, even though the splinter's out. The exact same concept with the vaccine that's breaking the skin. So vaccines are designed to stimulate your immune system, which means the immune cells are going to come there. You're going to get increased blood flow. So it's going to get the most common side effects are redness, swelling, tenderness. It typically happens about 24 hours after most vaccines or the first day or two. And because, again, vaccines are designed to give you long-lasting protection, the immune system needs to communicate with other cells throughout the body. And when it communicates, the immune system's really smart, but it's also kind of dumb because it only has one way to respond. And that communication makes you feel a little sick and it can cause fevers. So it responds as if it's the real thing, even though it's just that dead part of a germ. So commonly you can see children just feel a little off, is the best way to describe it, for the next day or two as well, after a vaccine. And then the live vaccines, the ones that are just weakened forms of the germs, so measles, mumps, rubella, and the chickenpox vaccine, you can sometimes get a rash with those that happens about a week later. And then I said, when do you call your doctor? I think anything outside of that extreme, especially if your child is not acting, can't support himself, can't eat or drink, things like that. Anything that seems very severe, talk to your doctor right away.
Smart Start, you have your hand up.
Yeah, hi all. I'm speaking from inside a room and there's multiple people, so I hope, and I'm sorry, it was just too long to type out again. I asked that first question about the number of families that are opting out nowadays, that we see so many more. And I thought that was going to be the answer, was exactly the answer you gave. Thank you. It puts everybody at risk. This might be a little bit more for my friends on the public health side, but so is there any protocol in place, or is there anything we should do when we know that, because we have their records, we know a family has opted out and their child is not immunized? Do we have any obligation to inform anybody else in that center, in that classroom, the families in that classroom? I find that such a conundrum, and I've struggled with this the last few years, because like I said, we have so many more children. And I really was starting to freak out with the measles thing, thinking, oh my gosh, what if we see an outbreak? So I guess this is more a moral question, ethical than anything, but do we have any kind of obligation, or is there anything in place that lets us let others know there are unvaccinated folks among us? Or should they just not worry if they are? I mean, if they're at risk, they're at risk, right? I mean, I don't know.
Go ahead, Dr. Cole.
No, I was gonna say she stumped the doctors. Go ahead, doctor.
Well, I'm trying to understand it. I'm trying to make sure I understand her question. Certainly, the individual who's most at risk is someone who is unvaccinated.
Right.
And so if you mean, are you trying, one thing you have to do, we have to maintain confidentiality.
Exactly.
So you sure don't want to say to someone, hey, little Susie isn't vaccinated, so let's be careful like that. We must maintain confidentiality.
Of course, yeah.
I think just using general educational points, like it's so important for you to make sure your child is up to date on their vaccinations in order to protect, again, those who might not be able to get vaccinated, or there is even a very small chance that if you are vaccinated, your body didn't respond and produce enough immunity, and then you might still be at risk if exposed. The other thing is, it's hard to answer your question for every single disease because of the differences in those. But something like measles, if there was a case of measles in a classroom, we would, from a public health perspective, we would quarantine those who have not been vaccinated because they are at high risk of developing and then spreading to others. So there, in some cases, in some disease processes, somebody who is unvaccinated will be asked to stay home and away from others to prevent becoming infected and then spreading it to others.
Thank you.
I think that brings up a really great point. So in terms of that, I think that folks that choose not to be vaccinated, I don't want to lump people onto a category, but many people who choose not to be vaccinated are not really concerned because they feel like the germs aren't real. And so even to exclude themselves from activities, that would not be something that they would do, even though it's most impactful to them. And so I think it's really important that we help people realize how you're jeopardizing yourself if you choose not to be vaccinated. We know all the reasons. Now we are educated on all the reasons why we should be, but there are some people who just believe they don't need to be vaccinated because they don't feel that germs are real. They don't believe that vaccination helps. They don't. Some people have thoughts about the conspiracies of why we need to be vaccinated through the government and all these other kinds of things. So when we say separate the children for their own safety, when things like mumps and whooping cough and things like that come out, people probably would not self-select because they don't feel that it's a jeopardy. Um,
Mhm.
so that is a whole nother panel and a whole nother conversation. But thank you for bringing up that point, Mary Margaret. There's a question here that says, do you recommend adults having, is it titers drawn if they're going to be around infants or immunocompromised children? I don't know what that is. Panel, do you?
Ultimately, I think that was speaking to measles. Maybe not. You can correct me if I'm wrong. We would like to be able to tell that people had the disease, or have been vaccinated. Titers, though, are an option for determining immunity. And if I could just really quick speak to the conversation in pre-K, one of the tools or techniques we used during this measles outbreak is to make sure that we communicated how it could impact unvaccinated persons, and to let them know that, if somebody has measles and your child is exposed and they're not vaccinated, they could be out for up to 21 days.
Yeah.
And that seemed to help, I think, around the country in the states that were affected, when people recognize, hey, I might have to figure out childcare, or I might have to stay home from work for that amount of time. It helped them to rethink that situation.
And then to add to the question about the titers, for those who don't know, what a titer is looking at, do you have the antibodies in, what is the level of antibody in your blood to the vaccine that you may have received? So it's a way of testing, like, are you immune? Do you have a high antibody titer? That becomes a tricky question, and I'm trying to think of how to say this without making it too complex, but it depends on which disease we're talking about, whether or not a titer would be helpful, because some vaccines, your titer level may wane a number of years later, but the memory is still there, and your immune system will still respond if exposed to that germ. Hepatitis B vaccine is an example of one of those. So it would be important, if you feel that you are around immunocompromised folks, to talk to your primary care provider about what protections you should have to make sure you're not putting anyone else at risk.
Appreciate these responses, and sometimes when we do these panels, I really hope that I use myself as an example, as a barometer, that if I come to some clearer understanding by the end of the conversation, then I feel like other people will too. And I feel like I've learned a lot more about vaccination and the benefits of that. And I want to go through and ask each of you, just to close, one final question. And that is, if you were speaking directly to parents who are undecided about vaccination, what is it that you would want them to know? Let's start with Adam.
I think we've all used the phrase, or most of us have used the phrase, a lot of information is out there right now. Yes, there's a lot of information, and it brings me no joy to say that some of that information is intentionally meant to confuse you and to sound scary. And I'm really saddened by that, that we're going through that. So the fact that you have questions or feel uncertain about vaccines is okay. Please just don't let that paralyze you into indecision, though. Go talk to your doctor about your concerns. And at least from my standpoint, I can very safely tell you that my recommendation to give vaccines to your child is not based in morality. It's not a right or wrong decision, but it's because we have 80 years of data to show that this is one of the best things I can do for your child to help protect them from so many different bad things.
Thank you. Emily?
Yeah, it's a conversation that I have frequently when talking to patients and their families. And, I always, one, will use myself and what I've done for my child as an example of how important this is. But first, again, I respect that these decisions feel important. You're making choices for someone that you love maybe more than anything in the world for some people. And that deserves thoughtful conversation and not pressure. So I'm careful not to pressure people, but also, speak both from the heart and directly. Second, I recommend vaccines because I genuinely believe that they are going to reduce potential suffering in children. And if they ask for examples, I share that I've taken care of infants struggling to breathe from rotavirus in the hospital. I've seen how quickly influenza can cause hospitalization in a healthy child, and that these diseases are not theoretical. To your point about germs, that vaccines will dramatically lower the risk of these poor outcomes in children. Similar to Adam, I say my recommendations are not based on pressure from anyone, not, insurance companies, not, the pharmaceutical companies who make vaccines, that they are one of the most studied medical interventions that we have. And then finally, it's just about, again, meeting, families where they are, that questions are welcome. I love questions. I love having discussions in the office. I also tell parents, if you have a question about any of the side effects, even if they're not the urgent ones, call me anyway, because what I don't want is, a new mom or new dad sitting home with the infant and they're, more cranky than normal and saying, oh, well, I can't call my doctor because I don't want to bother them. No, call me so that I can answer the questions and provide reassurance. So, when I recommend vaccines, it comes from the same place where I recommend car seats, seat belts, smoke detectors, and not smoking around your child. It's about lowering the chances of something devastating happening. And then I'm here to answer any questions.
Awesome. Bonnie?
Yeah, I think the most important thing I would want to get across is all of us who are parents, we want to do everything possible to protect our children and make them as healthy as possible. And vaccines have been so successful that it may have actually caused the problem where people say, well, some of these diseases, you don't even really see them anymore, so I don't need to worry about vaccinating my children. But as some of the other panelists have pointed out, the reason you don't see them is because everybody is vaccinated, or a large percentage of the population is vaccinated. But if vaccination rates drop, if more and more people choose not to vaccinate their children, these germs are still out there. The only one we've completely eradicated thus far is smallpox. So the germs are out there. And if herd immunity drops, if more and more people are vulnerable, those diseases will come back and they will cause the morbidity and mortality that we used to see 100 years ago and don't anymore. So it's so important to protect kids by assuring they have their vaccinations on schedule.
So, Jennifer?
Yes, so just like everybody else has said, so vaccination, we equate that to protection. So just like we use seat belts when we get in the car, you put your baby in the car seat, same type of thing, the way you can protect your child. I will say that there's a program called Vaccines for Children that's provides free vaccines for our uninsured, underinsured populations. So if finances are a barrier. There's something out there just because the CDC, the states want to make sure everybody's vaccinated. So if you are concerned about costs, please, contact us, ask questions because there are programs available for children, also some adults. So if access and cost is a concern, please speak to us because there are programs available. I am just very excited that I was going through my immunization record. So when I got old enough for my mom to hand over stuff to me, I found a little card from the health department that my mom had taken me to a community event. And I was tickled. I was like, oh, she took me to a community vaccination event. So it was just a full circle moment, something that parents have done for generations, and proud to be part of that and now giving back to the community. So this is something that I'm passionate about and that I believe wholeheartedly in. But as everybody else has said, if you have questions, please ask because we are more than willing to have that conversation with you.
And finally, Joy.
Yeah, so I think the brilliant individuals on this panel have shared great information for parents. I would like to just take a moment to say that our program, our communicable disease, also houses the Child Care Health Consultant Program, which is funded by Smart Start. Thank you guys. And we are in a position to be able to support pre-K or child care facilities that are listening or may not be listening and hear this later, have these conversations with parents about vaccines and why they are important. So you can reach out to us, and I'll share the information to make sure that it's available widely.
Usually I end the conversation with a few words, but I want to end with a message in the chat from Dr. Devanya Govan Hunt from BCDC. I want to take a moment to truly applaud the medical professionals who are leaning into partnership with families and recognizing parents as their child's first and most consistent advocate. That matters more than we can fully measure. When you acknowledge that families are coming from a place of love, doing their best with what they know and what they've lived, it builds trust. It's also important to name that how information is shared is just as critical as what is shared. Choosing not to apply pressure and instead delivering guidance with care, respect, and clarity allows families the space to process, ask questions, and make informed decisions without fear or shame. Thank you for holding both knowledge and compassion in the same hand. Thank you all for what you do for us here in the county. Thank you for serving families and serving with heart. We appreciate you guys joining us today. Thank you for your wonderful words and your information that's going to carry forth. And I hope that each of you who's on today shares what you learned today with someone else, or will be sharing the link to this recording on our website. Please feel free to share the link with your friends so that everyone can be informed and we can all make great decisions based on knowledge and compassion. Thank you all and have a great day. Thank you for joining us.
Thank you.
Thank you.